So I'm no longer Tony Ryan. My name is Fatima. I'm a midwife. I'm 60 years old. I was trained in the midwifery school in my province when I was 20 years ago. All my children were born, and so it's much easier for me to be a midwife. I got 2 years training and then returned to my village, and I've been there since. I've seen a lot of good things and a lot of bad things, but I want to tell you about a story that happened to me last week. So I went along the house with my box of equipment and a bucket of cool boiled water in my village over to see Sarah, a 16-year-old girl who was having a baby. I was hoping and expecting this would go very well. And when I went to the house, I introduced myself, and the two grandparents were there, her mother and her husband's mother. Everyone else was outside the house, and people gather around the house because every birth is a festival in our village. And so I set up and got a clean space, closed the curtain, tried to keep the room warm. I then made a table where I had some equipment, which I'll tell you about later on, where I got some training. I put them for the side. I haven't had to use these things yet. But the story was that about 6 months ago, I was sent up to Khartoum, and I was trained in a program called Helping Babies Breathe. And when I left that day, I had this bag mask, I had this suction, I had a book, and I got a poster to bring along to the medical centre. So every 2 weeks, I go to the medical centre, which is about 20 miles away from the village, and I meet my colleagues there. So I've never had to use these equipment, but last week, when I went to Sarah's house, it was a difficult delivery. It was long, and I had to do a large episiotomy because she was cut, which most of the girls are. And when the baby did come out, I know the baby wasn't crying. There was no cry, and that's a big shock when I see that. So what I learned was to dry the baby, not to panic, just to dry and quickly, and rub her at the back, and then get rid of the wet towel and cover her. I saw some mucus in her mouth, so I suctioned her mouth. I then put on a bonnet to keep her warm, and she still wasn't, there was no breathing, she wasn't breathing. And so I took her head and took my bag mask, and I squeezed a number of times. And then suddenly her chest wasn't moving. I brought her head back more, squeezed again, and then I heard it. She started to cry. And then I was shaking at the end of it, and I covered her up well, and I brought her over to her mother, and I kept her warm by putting her on her mother's tummy, and I was relieved. I went back and delivered the placenta, and Sarah's baby was born. One of the mothers, her mother started to cry, and I asked her, she said, "I'm crying with joy," she said, that you have been able to save our baby, but also with sadness because I lost 2 of my own babies, and if you had been here like this, maybe my 2 children could have survived. That's the Helping Babies Breathe program, and that's exactly. Now, I know that I was part of research. I was a midwife in our village, and Dr. Professor Salah at the Khartoum University and Dr. Ali Aber, they used to come to our clinic twice a week, and they came for 6 months first of all, and we would tell them the stories of every baby who died. They would document it carefully. Then we had the Helping Babies Breathe program, and we continued on that documentation for another year. They also, when we had done the Helping Babies Breathe, they looked at our training, our resuscitation skills beforehand, and then they followed them up for 12 months. So the results of these 2 things are as follows, on our research. Number 1, at the end of 12 months, I'm happy to say that they showed that 75% of our midwives were able to use this bag mask still after 1 year's training. And they also showed that there were other important changes in our practices, and I could see that. I think one of the reasons why we were so good at that every week, when we met at the centre, we did what they called high-frequency, low-dose training. And so it was every week, and just a couple of minutes coming, and they left this mannequin in the health centre, and we practiced with each other, and we helped with each other. This may look simple, but it's very hard, and you lose your skills very quickly. So that was one part of the research. They followed 71 midwives, and there were 1,300 deliveries observed beforehand and 3,040 deliveries observed over the next 12 months after the Helping Babies breed. They showed, when we brought back our report, that the drying of the babies, we were not as good, didn't take care of drying babies as much as we do now. But from our report, they showed that the drying of the baby went from 8.4% to 75%. And you know what it's like. We don't have a shower in our village, but I know when we wash it, if we don't dry ourselves quickly, we will get very cold. Imagine what the way a baby gets cold. Just think about that 1 minute. They also told us that, and we knew this, if the baby does not breathe in the first minute, that baby will die. And what we showed in the research was that 8% of deliveries, the bag mask was used. So nearly 1 in 10 deliveries were the midwives using that bag mask to fit and help the baby breathe. And if we can get it breathing, there's a good chance it will survive. What they also showed was that they said, the number of stillbirths has gone down. I was surprised at that. Why were the stillbirths going down? And they said, many of the babies that look like this, limp and not crying, they're not dead, they said. And we saw that because once we gave them breathing help, the babies became vigorous again. I told you the reason why we were successful is because we do high-frequency, low-dose training every week without fail. I'm also a Helping Babies Breed trainer. They have trained some of the midwives to be trainers, and now I can train the new midwives and midwives in other villages when they come to the medical centre as well. This has been fantastic for me, and I just love the teaching. To date, they say that all over Sudan, over 2,500 midwives have been trained since the Helping Babies Breed program started. I also heard that there are new programs coming, and this is what I'd like to be trained in as well. There's one called Helping Babies Survive, and they teach us how to keep a baby safe in the first few days after life. Because 1/3 of babies die in the first week, 1/3 of babies die in the first month, and 1/3 of babies die beyond the first month. And we can save these babies, and we can make a healthier population and stop the women having more babies when their babies do survive, and it will be safe for mothers as well. So this program is called Helping Babies Survive. Mothers survive. We haven't done that yet. But most mothers who will die in the first few hours after birth die because of bleeding. They just bleed to death. And we know that can be prevented. Another reason why this program is so powerful is because this program was directed at women, the midwives, who look after women. And women have been neglected in our health systems. And also, it's directed at women far out in the areas, even thousands of miles away from Sudan, or from Khartoum. And quite often, the women working out remote areas do not get equal access to the limited resources that we do have. So it's empowering women, and it's educating women, and it's powerful for that reason as well. I heard also that they've started to train all the new midwives in Helping Babies Breed. They call it in-service training. And I think that's a great idea, because now they will come out much better trained than I was, and they'll be able to look after the mother, but also be able to look after the baby and help babies survive. I think it also helped because our Ministry of Health have contributed a lot. While the Irish doctors did the training initially, and Irish Aid provided money that bought all of these equipment, €25 a midwife, our Ministry of Health had a great buy-in. They bring us to the centre, they pay for our travel costs, they pay for our overnight stays, and they look after us very much as well. So I thought this was a very good partnership with our Ministry of Health. And I also saw that, all of this began with a small number of people. There were Dr. Merwan Moniem, who paediatrician. He is the champion of HPV in Sudan. And also Sister Hen, she has travelled all over the country looking at the different courses that are run. And she's taken photographs and she's sent them back, and you can see how happy the midwives are after their training. We are very careful with our equipment. We know how to clean it, and we've been taught about that, but this is not going to leave my hands and not leave my bag. It's so vital for me. Unlike in hospitals where things just disappear, we are totally committed to the individual baby, and we will look after our equipment. So all of this happened with a £50,000 grant from Irish Aid. 2,500 people trained. I looked at Andrew, 15,000 trained for 30 million. 50,000. I did my numbers. And it cost him 300,000 to train 2,500. But there's many reasons for that, because our course is only one day. The other thing I told you about how much the ministry have said, it's not all about money. It's the money that comes in kind. The ministry really are involved in this program. And it's also, I'm glad to say, that Dr. Moniem told me last week, he said, you know, my headache about helping babies breathe is becoming their headache, what he said to the Ministry of Health. He knows that they cannot afford to leave this go. So that means sustainability. So that's what I'm hoping for the future, that Irish Aid will continue to do the good work that they have started with the program of helping babies breathe in Sudan. Thank you very much.